Thank you for joining the Foundation for a Healthy Kentucky's Health for a Change webinar, recognizing Healthy Kentucky Champions. I'm Allie Wells, Communications Associate for the Foundation. Joining me today is Matthew Coleman, one of our Community Advisory Council members. We're really happy to have him. Before we get started, just a little bit of housekeeping. We've enabled the live transcript feature on this webinar. You can control whether you see the closed captioning by selecting live transcript. It's on the bottom of your screen. We'll also invite any questions you may have, just type them in the chat box and we'll address them during the Q&A portion of this program. First, just to tell you a little bit about us, the Foundation for a Healthy Kentucky is a nonpartisan, nonprofit organization focused on healthcare access and children's health. Much of what we do is in the policy realm that can be on the state level, local level, or even the school or organizational level. So we're here today to tell you all about our Healthy Kentucky Champions Award program. You may have originally known it as the Healthy Kentucky Policy Champion Award, but we took out the policy and made the change in the name just to be more inclusive of all the great work that is going on. So just some of the basics about the award program. This is how we recognize Kentuckians who are working to improve the health of their community and or the whole Commonwealth. That is a pretty broad statement. So just to help you understand a bit more, these are some of the ways to describe what we're looking for. It can be a Kentuckian who has invested time, energy, and dedication to improving the health of their community and or the whole state. It can be a leader who has demonstrated their commitment by advancing programs, research, policy advocacy, initiatives to address unmet health needs of Kentuckians. It can be an exceptional person who has participated, led, mentored others in efforts to address and reduce health risks, disparities, and promote health equity in Kentucky. So when you're thinking about the people you know, this could be someone really involved in a certain project and they've gone the extra mile. It could be someone working with city or state leaders on policy. Maybe it's someone doing more on the ground type of work, someone teaching others about best practices. We really want to hear about it all. And one thing to note, whatever they're doing, it can be statewide level, but it can also be on the community level as well. And the nominees must be an individual who lives and or works in Kentucky. There are a lot of benefits that come from participating in this program. On the surface level, recognizing people for their hard work is just a nice thing to do. People like to feel appreciated. And one thing I think that's really important to think about with this program, this is a great way to spark more potential change. Kentucky is a really big state, and there could be something happening in one county that could really benefit another two, and they just might not know about it. So by raising awareness and doing this, we can help bridge that gap and open doors for future collaborations. And then the next great thing about this award is what's at the next level, which is the Gil Friedel Award. The Friedel Award is named after Dr. Gil Friedel, who was a passionate advocate for access to health care, the first director of the Markey Cancer Center at the University of Kentucky, and co-founder of the Kentucky Cancer Registry. Dr. Friedel helped launch a nonprofit advocacy education organization in 2012 that later became the Friedel Committee for Health System Transformation. The Gil Friedel Award winner is selected from the Healthy Kentucky Champion honorees each year. It includes a $5,000 grant given to the Kentucky nonprofit of the Friedel winner's choice that is working to improve health policy in the Commonwealth. The winner of the Friedel Award is announced every year at the Howard L. Boast Memorial Health Policy Forum that happens in the fall. So those are just some of the basics of what you need to know about this awards program. Each year, once we've gotten all of our nominations, there's a committee that decides who the honorees are. And Matthew Coleman from our Community Advisory Council is part of that group of folks who determines who the champions are. So I'm going to turn things over now to him for a few minutes just to talk about what the committee is looking for when they're making those decisions.
All right, thank you so much. Just a quick run through the list here of some of the things that we kind of look for. Obviously, as Allie mentioned, we are definitely looking at those three factors of who to nominate. When we're looking at it, we're looking through the Kentuckian who has invested time, energy, and dedication to improving the health of their community and their commonwealth. We want to look at that leader who's demonstrated their commitment by advancing programs, research, policy, those things that Ali had said. And then again, that person who has participated, led, or mentored others in efforts to reduce health risks and disparities and promote health equity. Just a quick run through. Last year, it was exceptionally competitive. We had over 20 applications I know of that we had sorted through as a committee, and had 7 awards that were eventually finalized. So kind of some of the key areas to look for in the application, and I'm sure they'll post the link here to that just for your nomination. That the key areas: nominee biography. If we're having a meal, this is kind of that appetizer. It helps us, learn to know about the nominee. Get the council, the committee that's working on that, help us get to know them. So that's that short, maybe a paragraph, maybe 2. It does not need to be the book of the subject here, because that's, we're wanting to get to know them, not know. The next part is the meat of it, that meat and taters, the actual entree is the summary of the nominee's work. That's the real substance of it. So what we're looking for is we're looking for like that area of impact. Are they a local impact? Last year, I know we had winners that worked more at the school level, and that's just fine. But maybe it's somebody who's working at a region, state, or national level. So we're looking at what is that impact, and sometimes it's not a huge number of people, but the impact on those people is great. It's a large impact on that small number of people, or it could be a large number of people, depending on what their work is. Then make sure in that nominee's work you're sharing the demographic. Who are they working with? What's the population? Is it an underserved population? Is it in a specific region, as we stated? So that's part of it. And then what type of work are they doing? Make sure that you're kind of highlighting that. That was one of those 3 key things up at the top, but just make sure you're telling us, are they working through policy? Are they working through research? Are there programs? Are they doing multiple? I know that we've had awardees that have had multiple of those. So make sure that you're listing that. And then last is make sure that that are illustrating the impact that they are having. Give us what they are doing. Make sure that when we walk away, we can say, hey, they are impacting that area, whether it's local, region, state, or even at a national level. We want to see, when we read it, just on the first read, we should be able to say, okay, their impact is beneficial to our state and to the health of fellow Kentuckians. So that's kind of my short and sweet for Ali.
Short and sweet is good. That's what I like to hear. Yeah, thank you so much, Matt. Some great insights there that you can share from that committee and just what you all are looking for. So now to give just a little bit more kind of context and some examples of what he was talking about, I'm going to share with you some of our past Healthy Kentucky champions and their work. I want to just preface this by saying I kept the details brief for this presentation, and there is much more outside of what I'll be mentioning about each winner. I just wanted to give you all some high-level examples about their accomplishments. So first is Dr. Patricia Bautista Cervera. She is the Health Empowerment Coordinator at La Casita Center. She promotes health through workshops, informational videos, one-on-one communications, and other various means. During the pandemic, she found ways to educate the Hispanic community about the COVID-19 virus and promote preventative measures and vaccinations. So again, that's kind of an example of someone who's in her role doing a lot of different things that's all having a big impact on the community that she's working with. Next is Michelle Howell. She co-owns Need More Acres Farm in Scottsville. There she collaborates with local and state partners to increase equitable opportunities for farmers. Her farm co-founded the Community Farmers Market in Bowling Green, which piloted several supplemental nutrition assistance program incentives. Next is Mark Thomas. He is the Todd County School Superintendent. There, he helped establish a program that addresses students' social and emotional well-being through mental health case management. And Thomas played a crucial role in gaining needed buy-in of the program from staff in the community. So that's more of an example of someone who's just kind of gone the extra mile with the one thing he's working on. And now here are our two most recent Gil Friedel Award winners. First is Bill Wagner. He established primary care centers in Jefferson County focused on people who are low income, homeless, immigrants, and refugees. He was instrumental in the development of Kentucky's Medicaid expansion. He also worked during the pandemic to provide education, testing, and vaccines. Then there's also Denise Hall. She directed a drug-free communities grant for 10 years. Part of that work included implementing a drug education series in Trimble County and provided one-on-one education for students who violated school drug and alcohol policies there. That's a word. She also wrote other grants to help fill students' needs. So really just kind of going the extra mile of being invested in the students there and their overall health. Now I'm gonna walk you through how to submit a nomination. First, you're going to go to healthy-ky.org. That's our website. This is our homepage that you're seeing right now. And you're going to go up to the top bar and in the Get Involved drop-down menu, click on Healthy KY Champion Awards. That's going to take you to a web page that looks like this. And you're just going to scroll down a little bit. And eventually you're going to see this. And this is the nomination form that you're going to fill out. We're going to ask you for their name, any organization they are affiliated with, and any links to those organizations that you can provide. Then you'll see sections asking for a biography and a summary of their work. And this is what Matt was talking about earlier. The biography is where we really want to, learn about who they are as a person, where they live, what they enjoy doing, any work that predates what you are nominating them for, just, who are they? Then when you get into the summary of their work section, that's where we really want the details of what they've done specifically to better the health of Kentuckians. So keeping in mind what Matt mentioned earlier, what exactly it is they're doing and the impact that it's had. Those are the two most important things to have there. You'll also need to provide us with a way to contact you as the nominator. That's only because, we might have follow-up questions. The committee might, see something in a form that they want to learn more about. So they might reach out to you as the nominator. And then you'll also need to provide information on how to contact the person you are nominating. So if they've won, we can reach out and give them the good news. So that pretty much sums up the logistics of how to nominate someone. Now we are ready to just take any questions if anyone has any of those. So feel free to use the chat box now. While we're waiting, I will say for the 2023 nominations, those are due May 1st at 11:59 p.m. Central Time. So you have all day, Monday, May 1st to get those nominations in. Is it helpful to send in any letters of support? I'll say that's definitely something you can do. And there is when you're on the website, there's a little blurb down at the bottom of the nomination form that gives you the email of who to send that to. Matt, do you have anything to say about if you guys look at letters of support? You're muted still.
Every time. We have, but the most of our work, because a lot of it, when we're boiling right down to it, that might be that extra step in the end that helps them get over. If there's somebody that we're kind of on the fence about, that might be helpful. So, I mean, if you're willing to do it, put the time into it, and make sure that it's a meaningful letter of support. If it's just a canned, I've spent a lot of time with letters of support. If it's just canned and does not have that meaningful of what's really impactful that this person is doing, then it's going to get put to the side. But if they're on the line, and it's meaningful and it has substance to it, then yes, I think it could be helpful.
Good, great. That's a great question. One of our next ones is, will everyone who submits a nomination be notified of the final winners? So what I can say for that is we do our best to reach out to everyone who submitted a nomination. If we don't get back to you personally, we do a very public email newsletter. We're posting on our social media, on our website. And so we're doing a lot of public promotions of who the final winners are. So if you don't get a direct email from anyone at the foundation, you can just keep an eye on those sites. Then another question is, does this include progress in promotion of mental health and wellness? I would say yes. We're looking at all aspects of health that we want to be promoting, and we know that mental health and wellness is a part of that. Matt, do you have something you want to say?
I was just going to say, along the whole spectrum of healthcare, if you look at the past winners, it's a whole variety, from people that worked in clinics settings all the way to schools, everywhere in between, as you saw with the farming and food access. So definitely that fits. And even outside of that, you start thinking of what affects someone's health, really look into that. And that's what we're looking for, is that extra bit. So yeah, great question.
Yeah, that was a great question. Yeah, really, that was part of our thought process of when we dropped the policy out of the name. We really want to just overall be inclusive of all the great work that is going on. Is there a place where we can see past winners? Yes. Ashley put in the chat earlier the link that has the nomination form on it. And at the very bottom of that web page, you can find the list of all the past winners that we have. And then in the drop-down menu that I showed you all earlier of where you can click Healthy KY Champions Awards, there's also the Gil Friedel Award section, and you can click on there and see the past winners of that as well. Let's see. Can this be given posthumously? I don't know if we've ever done that off the top of my head, but I would say yes, doesn't hurt to submit it. Yeah, I can't think of any examples off the top of my head that's been done, but I'm not going to say we wouldn't do it. I think we'd all be open to that. Awesome. Okay, well, those were all some really, really great questions. If there are any more that you think about, I'll give you all my email here in just a second, and you can reach out to me and we'll get that answered for you. So thank you again, Matt, for joining us today. And thank you everyone who listened. This presentation will be available on demand, so be watching your emails, and it will also be posted to our website. That's healthy-ky.org. There's my email up there right now. You can reach out to me with any follow-up questions from today, or if you have any ideas for future Health for a Change trainings that you would like to see. So with that, thank you again, and I hope you all have a great rest of your Tuesday.